Thank you for watching. This is YouTube Medical University. Suddenly, but this is the reality of stomach cancer. The 5-year survival rate is 90% if detected early. However, if it is found after it has progressed, it is said to be only 10%. If only I had gotten a gastroscopy sooner. These are the quiet words of a patient who recently lost most of their stomach. In Japan alone, nearly 39,000 people lose their lives to stomach cancer every year. Famous actor Ken Watanabe and former pro baseball player Manager O have also announced being diagnosed with stomach cancer. It's not just others, Japanese people are especially at high risk for stomach cancer globally. You can see now this isn't just someone else's problem. How can we detect it early? Is there a way to prevent cancer? I'm sure many of you are wondering. Actually, if you have the right knowledge about stomach cancer and take appropriate actions, you can prevent it. And it's a type of cancer that can be detected early. So in this video, I'll talk about the surprising early symptoms of stomach cancer that can be dangerous if ignored, as well as signs that appear on your skin, and whether there are any tests you really should take besides a gastroscopy. I'll explain all of this clearly from a doctor's perspective. If you've been feeling like your stomach hasn't been quite right lately, or if you want to protect the future of yourself and your loved ones, if you watch this video to the end, your worries can become useful knowledge to protect your future. So watch until the end. Here is today's agenda. In the first section, I'll explain how the stomach and Helicobacter pylori are closely linked to stomach cancer. In the second section, I'll discuss the surprising early symptoms of stomach cancer that many have been waiting to hear. In the third section, I'll discuss which tests you should take. What about tests like the ABC screening or barium tests other than the endoscopy? From a doctor's perspective, I'll tell you which test I would choose. And finally, is there any way to avoid getting stomach cancer in the first place? With these new findings, we now know which foods reduce stomach cancer risk, so I'll explain that information. So first, I'd like to talk about the stomach and Helicobacter pylori. Many people might not actually know what functions the stomach has, but in fact, the stomach plays a variety of roles. Among those, the most important role is that the stomach acts as a pouch to temporarily store the food you eat. It's an organ that temporarily stores food and digests it. Of those, the most notable feature is the gastric acid, right? This gastric acid is actually a very strong acidic liquid that's said to be even more sour than a lemon. The hydrochloric acid from science class is the main component. So, when you throw up or when gastric acid comes up, your mouth tastes bitter and sour because of this gastric acid. Do you know how much gastric acid we produce in a day? The answer is, surprisingly, we secrete about 2 liters of gastric acid every day. That's equal to 400-500 ml bottles. This gastric acid helps us break down food, and because it's highly acidic, it also plays various roles like killing harmful bacteria that enter through the mouth. As a side note, it's said that this gastric acid can even dissolve iron. That gives you an idea of how powerful it is. However, even in such a harsh environment like the stomach, there are bacteria that boldly live there as if they own the place. That's what we call Helicobacter pylori. You might wonder how it survives in such a strong acid. Well, this Helicobacter pylori, it's very clever and uses an enzyme called urease to create an ammonia barrier around itself. Ammonia is alkaline, so by creating this barrier, it protects itself from stomach acid and manages to survive inside the stomach. Helicobacter pylori is believed to settle in the stomach when transmitted from parent to child, usually via mouth-to-mouth contact while the child's immune system is still developing. Once it settles in, it gradually damages the stomach lining over many years. In fact, infection with Helicobacter pylori is considered the biggest cause of stomach cancer. People with Helicobacter pylori have constant stomach inflammation. In other words, the inside of the stomach is slowly and continuously experiencing inflammation, like a low flame. When the stomach lining keeps getting damaged like this, the cells regenerate in order to repair it. Cancer cells may accidentally develop during this process. It's easier to understand if you consider the reason behind it. In other words, actually eradicating this Helicobacter pylori is the most important thing when it comes to preventing stomach cancer. Reports suggest eliminating Helicobacter pylori in your 20s may cut future stomach cancer risk by up to 90%. That's impressive, isn't it? Please let me know in the comments if you or your parents have ever been infected with Helicobacter pylori. You might be surprised to find that people around you have it. Here at YouTube Medical University, we actually perform gastroscopies and diagnose gastritis. As a practicing physician, I share key knowledge to help you prevent disease and get healthier starting tomorrow. I'd appreciate it if you could subscribe to the channel before you forget which one it is. As you've been waiting, in part 2, I'll explain what happens to your body when stomach cancer develops. I'll introduce some unexpected danger signs. Here are 5 warning signs of stomach cancer, starting with the first one. A black wart appears on your skin. You may wonder, isn't this about stomach cancer? Why mention skin? That's a fair question. This might actually be the most unexpected sign. Seeing is believing. Please take a look at this image. This is commonly known as a senile wart. These warts actually appear on the body as you get older due to aging. However, what I want you to be careful about is if these kinds of warts have suddenly increased rapidly on your body over the past few months. Please be careful in such cases. Other than that, these warts usually aren't painful or itchy, but if you start to feel itchiness in these warts, that's actually a sign that your risk of stomach cancer may be increasing. If you just have warts to begin with, it's usually not a problem, but if you check the mirror every day and notice that these warts are increasing, it could be a warning sign. Please consult your regular doctor or a gastroenterologist. I introduced this because I think most people wouldn't realize that skin symptoms could actually be a sign from the stomach if they didn't know about it. The second warning sign of stomach cancer is unexplained nausea or loss of appetite. When a foreign object like stomach cancer forms, it is typically hard. This can cause inflammation, making the stomach's peristaltic movement, kneading and pushing food toward the duodenum, more difficult. Peristalsis becomes harder when cancer is present in the stomach. As a result, even if you eat, the food doesn't pass through easily, which can cause symptoms like nausea or loss of appetite. And as stomach cancer progresses further, it leads to a condition called cachexia. Even if you eat food, the nutrients are taken by the cancer, so you don't feel like eating. You may reach a point where you don't even feel hungry, and as a result, you might start losing weight. If you've recently noticed a loss of appetite or nausea, please don't ignore these minor symptoms. It could be a sign of stomach cancer. A warning sign of stomach cancer. The third of the 5 signs is this: dark-colored stools. Do you all check the color of your stool after a bowel movement? Many people say they usually don't look. However, this is a very important sign. Many people think that if there's bleeding from stomach cancer, the stool will turn red, but actually, it most often turns black. The reason is, when bleeding occurs in the stomach acid reacts with the blood, causing oxidation, which turns the blood black. It's not just dark stool. If your stool is truly pitch black, like ink or charcoal, this is truly a dangerous sign. When we medical professionals see black stool, it makes us turn pale. That's because it's a dangerous sign. If there's 50 to 100 ml of stomach bleeding, the stool turns black, showing significant bleeding. If there's heavy bleeding and no time for oxidation, blood may appear red in the stool. In any case, it's a dangerous condition, so if you have such symptoms, please consider going to the hospital immediately. Be cautious. Taking iron supplements follows the same principle I mentioned earlier. Iron turns black, so your stool will also turn black. If you regularly take medication, it's possible that your stool is black because of the medicine, so I think it's a good idea to ask your doctor or pharmacist about it. Here is the 4th warning sign of stomach cancer: pain or discomfort in your upper stomach. This is not an early symptom. It only appears after the disease has progressed to a certain extent. That's why I don't want you to overlook this symptom. Anyone can occasionally feel some pain around the pit of the stomach, right? However, when it comes to stomach cancer, there are actually many people who report that kind of discomfort or pain as well. Stomach cancer often appears on the surface of the stomach lining, but as it gradually grows larger and starts to dig deeper into the stomach wall, it can touch nerves or release cytokines and inflammatory substances due to inflammation, which can cause discomfort or pain. In other words, these are signs that appear after the tumor has grown to a certain size inside the stomach. Discomfort or pain in the pit of the stomach is common, but some situations raise more suspicion of cancer, so keep this in mind. First is worsening pain in the pit of the stomach. Second is pain with no identifiable cause after tests. If it's just mild gastritis, it usually gets better on its own or improves with stomach medicine. However, if the cause is stomach cancer, it might temporarily get better, but it often gets worse again. And what's characteristic is that the intensity of the pain gradually gets worse. If it doesn't improve, gets worse, or your usual medicine doesn't help, These could be signs that increase the possibility of stomach cancer, so please consider seeing a doctor or consult your regular physician. The fifth warning sign of stomach cancer is this: having no symptoms. It may sound contradictory to call no symptoms a warning sign, but I want everyone to remember this, so I'm mentioning it here. I've talked about 4 symptoms so far, but the most important and most frightening thing is that often there are no symptoms at all. There is some data like this. In Japan, 74% to 78% of asymptomatic people diagnosed with stomach cancer through screenings had early stage cancer. On the other hand, among people who had some symptoms and were diagnosed with stomach cancer, only 26% to 36% had early stage cancer. So, what does this mean? It means that when people had no symptoms, early stage cancer was more common, but by the time symptoms appeared, early stage cancer was less common and more people actually had advanced cancer. In other words, relying on symptoms makes early detection difficult, and that's the sad reality of stomach cancer. That's the reality. Even if cancer has advanced somewhat, as long as it hasn't spread to distant organs, surgery can sometimes remove it completely. So having symptoms doesn't always mean it's too late, but if cancer is found before symptoms, endoscopy alone is more likely to remove it. This highlights the importance of cancer screenings when you're symptom-free. Some people demonstrate how crucial it is to get checked while healthy. On a different channel from YouTube Medical University, Yuki, diagnosed with Sirhouse gastric cancer, openly shares videos about their diagnosis, symptoms, and post-surgery experiences. Initially, she had no symptoms, but after some discomfort and an endoscopy, the worst type of cancer, serous gastric cancer, was found, and she underwent a very difficult surgery to have her entire stomach removed. She also shared her experience with us. I'm sure it will resonate with you, so if you'd like, please check it out from the description or comment section after watching this video. Let's review the second period and discuss unexpected stomach cancer warning signs. First, an increase in skin warts or the appearance of itching. Second, a decrease in appetite or the onset of nausea. And third, having black stools. And fourth, experiencing pain or discomfort in the pit of your stomach. And finally, fifth, I mentioned that in fact there are often cases with no symptoms at all. So, in the last part I talked about how it's important to get tested even when you have no symptoms. Now I'll explain in an easy to understand way which tests you should take and which ones I would choose myself. Can it be found with a blood test, or is a gastroscopy or barium test needed? Which ABC screening should you take? I think many people feel that gastroscopy is scary and uncomfortable, so they'd rather avoid it if possible. I understand how you feel. First of all, what I want you to know as a basic premise is this thing called organized cancer screening. This has been officially approved by national or local governments. These cancer screenings are scientifically proven tests that, if conducted, can definitely reduce the number of people who die from those diseases. And actually, this stomach cancer screening is also one of the 5 organized cancer screenings that have been established. Specifically, the 2 tests you can choose from are the endoscopy and the barium test. So, you might wonder if you can choose either of these 2 tests. Of course you can choose, but there is already a certain conclusion about which test is better. A large-scale study conducted in Japan concluded that endoscopy reduces the risk of death from stomach cancer by about 60%, while the barium test reduces it by about 37%. In other words, both are effective, but in terms of saving lives, endoscopy was found to be superior. Why does the barium test often miss things? It's easier to grasp when you consider its underlying principle. You drink a liquid called barium, which shows up easily on X-rays, and then they use X-ray imaging to examine the shape of your stomach and the smoothness of its surface. In other words, it's like looking at a shadow picture and judging by the way the shadow appears. They're trying to predict stomach shape or surface appearance by examining shadows, but this method can't show the color of the stomach lining or subtle surface roughness. In contrast, a gastroscope with a high-definition camera reveals details like color and blood vessels far more clearly than the human eye. By using a special light to detect color changes, doctors can identify signs of stomach cancer. This makes the gastroscope much better for stomach cancer screening. Of course, the gastroscope really. If you found it really tough and decided never to do it again, choosing the barium test is also one option. Of course, I think it's better to have the barium test than skip testing. However, gastroscopes are now thinner. Some go through the nose, and with sedation, the procedure can be done while you sleep. There are hospitals that offer those kinds of gastroscopy procedures. I hope you'll consider it again. And recently I've been getting questions like this. I've been asked, "Doctor, I heard that recently you can check for H. pylori with just a blood test without putting any strain on your body. Can you do that at this hospital too?" This is called the ABC screening. With this test, just by having your blood drawn, you can indeed determine whether there is gastritis in your stomach or if you are likely infected with H. pylori. It's great in that way, so it's included as a health checkup option. There are also places that offer what's called ABC screening. However, since it's only a blood test, it doesn't help with early cancer detection, but you can find out through a blood test whether you likely have H. pylori, which is the most important risk factor for cancer. In other words, I think it's a good idea to use the ABC screening as a way to check whether you might have H. pylori. However, even if you get a good result from the ABC screening, there are actually types of cancer that aren't related to H. pylori, or you could have something like serous gastric cancer. You can't rule out those possibilities. And if H. pylori is suspected, you need a gastroscopy for diagnosis. You can't get H. pylori eradication treatment under the framework of health insurance. Ultimately, if you're doing eradication, a gastroscopy is required, so keep this in mind. First, if you want to take the ABC screening, that's fine. But since you'll need a gastroscopy anyway, if you decide to do eradication, you can also choose to just go ahead and get the gastroscopy from the start. Please think about what you would like to do for yourself. This got a bit complicated, so if you have questions, ask in the comments. So, if you ask me which test I would take, needless to say, I would choose the gastroscopy. For those who are infected with Helicobacter pylori or have been infected before, I always recommend, if possible, to try to endure a gastroscopy once a year for just 10 minutes. For those who have never had Helicobacter pylori, I recommend having a gastroscopy every 2 years, following the usual cancer screening intervals. I hope you will consider this positively. Still, some of you may think, no one in my family had stomach cancer and I'm young, so I should be fine. I've created a simple self-checklist to help you determine whether you should get a gastroscopy soon and to assess your risk for stomach cancer. Please take a look at this. You're over 50 and have never been tested for Helicobacter pylori. You were previously told you were positive and haven't had eradication treatment, or a family member was diagnosed with stomach cancer. Fourth, you love salty foods and eat them often. Fifth, you smoke or have smoked in the past. Sixth, you've recently had heartburn, indigestion, or persistent discomfort in your upper abdomen. Seventh, you've lost weight without a clear reason. If you notice these symptoms, if any of these apply to you, I strongly encourage you to consider the possibility of stomach cancer. These are just general guidelines, but things like eating salty foods, smoking, or having a family member with stomach cancer, those kinds of things can actually increase your risk of stomach cancer, so I hope you'll use this information to help develop lifestyle habits that can prevent stomach cancer. Now, as a bonus at the end, here's a supplementary lesson about the latest research on something that might help lower your risk of stomach cancer. Some foods may help, so I'll quickly introduce them as a bonus. Those are actually vegetables, fruits, and the nutrient called dietary fiber. If you thought, well, isn't that just a healthy diet after all? You're absolutely right. The things that were commonly believed to be good for your health have been scientifically proven more and more to even reduce the risk of cancer. According to research, just 100 grams of fruit a day, about half a banana or one whole banana, was enough to reduce the future risk of stomach cancer by 5%. In other words, just by changing your daily snacks to bananas or apples, you might be able to lower your risk of stomach cancer. Additionally, people who ate more dietary fiber had a lower risk of future stomach cancer than those who didn't. There are even reports that the risk was as much as 42% lower, so it's important not only to eat fruit, but also to get dietary fiber from vegetables and other sources. For those of you who usually eat snacks or sweets when you get a little hungry, how about switching to fruit instead? Or when you have lunch, how about adding a convenience store salad that costs about 100 yen? It's really important to be aware of reducing your risk before you develop cancer, so please keep that in mind. Thank you for watching until the end. Helicobacter pylori is the main cause of stomach cancer. I introduced 5 unexpected risks and asked which test I'd choose: endoscopy, barium swallow, or ABC screening. I explained each test and suggested considering endoscopy more seriously. I added a checklist. Feel free to leave a comment, even a single word, about what you learned. I think it will be helpful for others, and it will also help everyone retain the knowledge better. At YouTube Medical University, we're aiming for 1 million subscribers. Please subscribe to support us.
Well then, let's meet again in the next video.
As a general practitioner, my patients have taught me how to age well after 70. I want to live that way too. I never knew such lifestyles existed, and these stories share what I've learned from many patients. I've learned from my elders that socializing matters more than exercise, and with medicine, less is often better. It's filled with wisdom on how to live healthily and happily no matter how old you are. Please check it out from the description below.